Hello everyone, this is Dr. Larson here. Welcome to tonight's webinar presentation titled The 6 Critical Thyroid Lab Tests. First, just a little bit about me. My name is Dr. John Larson, for those of you who don't know me. And I've been practicing and helping people with thyroid problems and all other kinds of health problems for over 18 years. My original degree, professional degree, is as a doctor of chiropractic, but when I first opened up my own practice, I actually didn't promote chiropractic. I promoted weight loss because that fit within my interest, or kind of my passion, I guess you could say, when it comes to diet and nutrition. And very quickly I found, as I was working with people in weight loss, the people that were coming to see me were sort of the worst of the worst, so to speak, in that they had already tried just about everything you can think of. And it became obvious to me early on that I needed to get very good at doing the proper and effective testing for thyroid function, and also figuring out dietary nutritional therapies to get a person's thyroid working better, more naturally. And so that was my kind of introduction into working with thyroid. It's been one of the areas of the body when it comes to body chemistry or hormone function. It's been one of the areas of the body that I've worked with the longest. And so currently, though, I spend much of my week teaching and helping other doctors and health providers incorporate more effective testing and therapies into their patient care. So I've kind of had a shift in the way that I'm working within my profession. I'm not only working with patients, I'm actually communicating with and doing some teaching and helping of other doctors to help them incorporate better testing and better therapies for their own patients. But I still spend part of my week working with patients directly, and I consult with patients all around the country, which is in the United States. I actually have some patients I've worked with even out of the country who are just having difficulty finding someone that can help them or want to work with them in the more detailed kind of testing that I typically do with someone. So your participation makes a difference in a presentation like this. This presentation on thyroid is less about the slides I've created and more about the conversation I'm going to have with you and the education I'm going to give you about thyroid testing and thyroid function within our conversation. So the slides that I've created, of course, are going to help you visualize what we're talking about, but it's really the conversation that I'm going to have with you that's going to be most important. And so I'm really relying on you as a person that's attending the live presentation to be asking me questions. I really would like your questions to in part guide the conversation that I have with everyone today. And so what that means is for this live webinar presentation, you'll see on the left-hand side of your screen there is kind of this chat box or chat window. So at any time you can go ahead and type in a question and hit enter, and then that question will pop up for me. And I'll be stopping periodically during the presentation to see what the questions are. If you are watching this as a video recording, because I'm recording this webinar presentation for other people to view later on, obviously you won't be able to, you won't even see this chat window on the recording, and then obviously you're not going to be able to ask me questions. You'll have to wait till afterwards you're done watching it, and then you can call or email me with any questions that you might have. So this is our topic, thyroid lab tests, and there are easily a dozen or more of the more common of the different thyroid lab tests, but what I found in my own experience over many, many years working with many people, it really boils down to 6 of them as being the most important or the most clinically relevant to understand what's going on with a person's thyroid and what needs to be done to be able to help them. And so I will narrow this list down here for you in just a little bit. But first we need to backtrack a little bit and just make sure we all start out with the same understanding of what the thyroid is and kind of how things work on a basic level. So first of all, where is the thyroid gland located? So as many of you know, the thyroid is located within the neck. It's actually below the trachea. And you can see by the diagram here, it's kind of fans out or expands on each side of the trachea or windpipe, and it's connected together in the front and the middle by a smaller band of tissue. And so a lot of people will refer to this as kind of a butterfly shape, and I think this is why you'll see a lot of images about thyroid awareness. A lot of times you'll see a butterfly as kind of part of that imagery when they talk about thyroid or thyroid awareness, is because the thyroid gland itself is somewhat shaped like a butterfly. But then I like this diagram because it points out these smaller nodules called the parathyroid, and so it's important that you don't confuse the thyroid and the parathyroid. They're very different in their functions. The parathyroid releases hormones that help control calcium levels within the blood and actually some other minerals as well, which is very different from what the thyroid does for you. The thyroid, the main function of thyroid is to produce thyroid hormone, which is one of the most powerful things in your body that determines the metabolism of all the cells within your body, which then becomes the metabolism of your entire body as well. So, welcome to thyroid school. And so first we want to go through what is this communication, or what is this chain of command as far as how the brain communicates to the thyroid and how thyroid hormone gets created and how that goes to the cell. So the brain, or more specifically a part of the brain called the pituitary, and the pituitary has the nickname of the master hormone gland because the pituitary releases hormones that will talk to and control not just the thyroid but also the adrenals and the ovaries or the testes as well. But with the thyroid, the brain or the pituitary will communicate with the thyroid through a hormone called TSH. And so many people have heard of TSH. Many people, if they've been concerned about a thyroid problem, this will be the most commonly done lab testing for thyroid function called TSH, which stands for thyroid stimulating hormone. And this is unfortunately, sometimes it's the only test that ends up getting done, and that's reflected. I had sent out an email prior to this presentation asking people to give me some feedback on what their frustrations are and what their questions are, and that was a common frustration that people were communicating to me when they replied to my email, is that a lot of times they will only get their thyroid tested, and it may in fact be within the lab's normal range, but yet they still feel like they have many of the thyroid symptoms. So this is kind of the great deception or confusion with doing TSH. TSH is a good indicator of what's going on with thyroid, but the confusion is that TSH can be within the lab's normal reference range, and if you only go by that one test, you can end up missing some important information about how the thyroid is actually working. And so it's not until you do a more detailed testing that it becomes obvious that there is not enough thyroid hormone in the system, or maybe there's some kind of autoimmune problem or some other things that we'll talk about. So the first priority is if you have concerns about thyroid, making sure that you are not only getting TSH tested, that you're getting a more detailed testing. And of course, this whole seminar or webinar is about getting those top 6 most critical thyroid lab tests done. So anyways, the brain will communicate with the thyroid by producing this hormone called TSH, and it's a little bit confusing to some people because the brain will produce TSH kind of inversely related to the amount of thyroid hormone in the system. So what that means is that if the brain is sensing that there's not enough thyroid hormone in the system, then TSH will increase. It's almost as if the brain is kind of, talking more loudly, or if it increases a lot, if TSH increases a lot, it's almost as if the brain is shouting at the thyroid saying, you need to produce more thyroid hormone because there's not enough in the body. Also, if there is too much thyroid hormone in the system, TSH will go down as if the brain is kind of quieting down. It's almost whispering to the thyroid saying, you need to not be doing so much. There's already too much hormone in the system. And so again, TSH is kind of the opposite of what's going on with the hormone levels. When there's too much thyroid hormone in the system, TSH goes down. When there's too little, TSH will increase to try to get the thyroid to produce more hormone. Once the thyroid gets activated, the thyroid will produce mostly a form of the hormone that we refer to as T4. And it's called T4 because the thyroid molecule actually has 4 iodine molecules attached to it. So that's why it's called T4, because it has 4 iodines attached to it. And so the interesting thing, though, is T4 is really not the most active or what we call the bioavailable form of thyroid hormone. It's not until T4 gets converted into T3. T3 is easily the more bioactive or bioavailable form of thyroid hormone. So what that means is that's the form of thyroid hormone that is doing most of the communicating, most of the kind of connecting with the cells in your body and communicating to the cells to determine your cell's metabolism, which then becomes the metabolism of your entire body. So the thyroid produces mostly T4. It does produce a little bit of T3, but it does so in a ratio of about 20 to 1. The thyroid produces about 20 particles of T4 to about 1 particle of T3. However, the ironic thing is that even though the thyroid produces so much T4 versus T3, T3 is actually the main player when we think about how thyroid is activating your metabolism and determining energy levels and such. So T4 actually gets converted into T3 in different parts of the body. Primarily, that conversion takes place within the liver. About 80% of the activation of thyroid hormone takes place within the liver. So this gives you a sense that having good, healthy liver function is also important to having good, healthy thyroid function or thyroid hormone levels within the body. So this could be one reason why a person is struggling in their thyroid hormone levels, is because their liver, maybe their thyroid is producing enough, but their liver is struggling. It's under different stresses, or something's going on with the liver where it's under functioning, and it is not doing an easy conversion of that T4 into T3. T3 does get converted in other places of the body as well to a lesser degree, but the majority of that conversion happens within the liver. T3 then, as the bioactive form of thyroid hormone, well, let me step back and say the critical nutrient that's needed for proper conversion of T4 into T3 is a trace mineral called selenium. And selenium is one of many nutrients, but even more so with selenium, where it's getting really significantly depleted in our food supply because it's getting depleted in the soil that the food is grown in. So this gets a little bit back to farming practices, but basically, as the same farmland gets farmed over and over again, gradually that soil gets more and more depleted, and one of those bigger depletions that's happening is selenium. And so if this is a conversion problem, some people are just not converting T4 into T3 very well. If it's a conversion problem, again, that conversion can be impaired because the liver is under functioning and it's not converting T4 into T3 as well as what it should be, or it could be as a result of a selenium deficiency, or it could easily be a combination of both. T3, or more specifically free T3, is what then comes in contact with all the cells within your body, and that determines the cell's metabolism. And in fact, if you get down to kind of the microscopic level, within all your cells, you have these little components called the mitochondria, and mitochondria are referred to as the powerhouse of the cell because they produce the energy. And specifically, it is the free T3 that comes in contact or communicates to the mitochondria, which then determines the amount of energy that those mitochondria are going to produce. Maybe a little bit more technical than you're looking for, but that gets kind of to the microbiology or the essence of what's happening within the cell. So it's important to know too that in lab testing we can measure the total amount of T3, but we can also measure what's called the free T3. And the majority of thyroid hormone, and really the majority of any hormone, whether it's thyroid or you look at adrenal hormones or the sex hormones like estrogen and progesterone and testosterone, most of the hormone within your body is in the non-free or an inactive form. It's actually bound to a protein, and it's not active, it's not communicating to the cells. It's not until it becomes unbound and becomes active, what we call the free form, that's when that hormone is having the effect on your cells and within your body. The majority of T3, over 99% or more, is in the total T3 or the bound form. A very small percent, 1% or less, is in that free T3 form. And sharing those percentages helps you understand just how powerful a hormone molecule is if only less than 1% of that T3 is in the free form, which is the form that's actually affecting and communicating to the cells. That's a pretty small amount compared to the total amount of T3. And so it's important to know that hormones, even in very small amounts, can be very, very powerful in the effect that they have within your body. So this is the ideal scenario, as we have great communication from the brain down to the thyroid. The thyroid is producing mostly T4. We're getting good conversion of T4 into T3. T3, or more specifically free T3, is easily communicating with the cells, and that in turn determines the cell's metabolism, which then becomes the metabolism of your entire body. We have this other component called reverse T3. You can sort of think of this as the anti-T3, because what reverse T3 does, it essentially creates a block and prevents the free T3 from communicating with your cell. And it's not so much a deflection. It's more this molecule of reverse T3 will bind to the receptor sites on the cell, and basically it prevents the free T3 from binding as well. So this is a scenario when reverse T3 levels go too high in the body. This is a situation called reverse T3 dominance. And what can happen is all the other thyroid testing can appear to be normal, even within the optimal range. And then, but if there's too much reverse T3, then that person and their body is still going to behave as if it is hypothyroid, or they're going to have symptoms of low thyroid function because of the excess levels of reverse T3. And the body creates reverse T3 as a way to kind of manage if there's too much T4 in the system. So it's kind of it is a mechanism within the body. I'll talk a little bit more about reverse T3 here in a little bit when we'll get more detail into the testing. Then we should talk a little bit about thyroid medication. The most commonly prescribed thyroid medications are the man-made ones or the synthetic ones, which would be Synthroid or levothyroxine. There's a few other ones as well, but Synthroid and levothyroxine are the most common ones. Those kinds of medications are man-made or synthetic forms of T4. But you still have the problem that even though it's a man-made or synthetic T4, it still needs to get converted into T3 and then into the free T3. So we still can have a conversion problem that if a person is getting only TSH tested and T4 tested because they're on a synthetic T4 or thyroid medication, those can appear to be normal in lab testing, but a person can still have issues with thyroid balance or have altered thyroid function because they may not be converting into T3 very well, or again still they might have too high levels of reverse T3, giving them that reverse T3 dominance. Some people too I work with, they're on a man-made or synthetic form of T3. Cytomel is one of the more common brands. There's other ones that are out there too. So that'll be one way. If you're working with a doctor that's a little bit more thorough in their testing and they find that T3 is too low, they might actually prescribe a man-made form of T3. And then, of course, there are the natural thyroid prescribed medications like Armour Thyroid, and there's actually several ones that are out there now. Typically, those are extracts of gland and extract of hormone that comes directly from an animal source. And those will almost always have both T4 and T3 within them. Let me just jump over to a couple of questions here. Diana is asking a question or making a statement here. I only get the TSH done, and I definitely still have symptoms. I'm on levothyroxine. The only thing it helps is keeping my hair from falling out. I'm hypo, is what I've been told. Hypothyroid is what she's been told. I've been trying to go wheat-free, gluten-free. Is this good? So the connection between gluten and wheat as it relates to thyroid function is much more specifically towards an autoimmune thyroid problem, which we'll get into in a little bit here. And so easily, some references will say 80 to 90% of people that end up with hypothyroid, it's because of an autoimmune condition. which I'm not sure how accurate those percentages are, but easily a lot of people that have thyroid problems, the autoimmune thyroid component is a big factor that results in a person having a thyroid problem or becoming hypothyroid. And one of the factors that we'll talk about a little bit later that can kind of promote or enhance that autoimmune reaction is a food allergy or sensitivity. So there's a strong connection between a gluten allergy kind of promoting this autoimmune reaction that happened with the thyroid. And we'll talk about that more in a little bit. Leslie's asking a question, where does iodine fit into this? So as we kind of talked about here, let me go back. So we talked about how T4, the reason why it has the designation of 4 is because 4 iodine molecules are attached to that thyroid molecule. T3 is because there are now 3 iodine molecules. So the role that iodine fits into thyroid function is the thyroid, as it's producing thyroid hormone, needs iodine in order to be able to manufacture that thyroid hormone. So iodine is definitely a critical nutrient towards the creation of thyroid hormone in general, just like selenium is a critical nutrient to allow for that conversion of T4 into T3. So for some people, especially if you're living where I'm in Minnesota, so it's in the central part of the United States, we typically don't eat as much seafood or shellfish. So our iodine intake can tend to be lower than people who live on the coast and have easier access to this seafood as well. And so I'm just reading another question, a comment here from Andrea. Looks like she's hearing breakups or pauses in my voice. Oh, okay. So you may find that I pause momentarily in my conversation because I'm actually reading a question that someone wrote, so I apologize if that's confusing you a little bit. So anyways, iodine is a critical nutrient, and Diana's asking here, do you suggest iodine or selenium supplements if a person is low in those areas? Typically, when I'm recommending a thyroid support type supplement or product, it will almost always have iodine within it. Very often it will have selenium within it as well. And so that would be one of the things I look for a good thyroid supplement type support product. Rachel here is asking a question, if you're allergic to shellfish, what is another good food to get iodine? Really, one of the best options is to get iodized salt, which is the reason why iodine was added to salt in the first place many decades ago. And you could also get it from kelp. You'll see a lot of thyroid or iodine type products will have kelp within it because that will contain some natural iodine as well. You want to be careful with the dosage of iodine. Some doctors will promote taking very, very high doses of iodine. The reality is your thyroid can only use about 150 micrograms of iodine within a day's time. And so this is why you'll see a lot of iodine or thyroid supplement products that will usually have that as kind of the limit that they'll offer for iodine. Now, iodine is used in other ways within the body. You have quite a bit of iodine that gets stored within your adrenals, and it's used in other ways within your body as well. But it's important to know that your thyroid can only utilize a smaller amount on a daily basis. There is such a thing as giving too much iodine, and what can happen is it can backfire, and that excessive amount of iodine can actually be part of what's shutting down or slowing down thyroid function as well. So to do a quick review of the symptoms of hypothyroidism, and I'm going to talk, in relation to thyroid, I'm going to talk more often about hypothyroid because that's the majority of the people that I work with, and that's the majority of the thyroid problems are hypothyroid. And so in this case for hypothyroid, some of the more common symptoms are certainly fatigue. A lot of people comment how they feel cold almost all the time, even when other people are feeling the room temperature is comfortable, or even when it's warmer outside, they still feel cold. Loss of eyebrow hair, typically that outer 1/3 of the edge of the eyebrow will kind of disappear as another indicator that there may be a thyroid problem going on. It's quite common that people will notice more achiness in the muscles and joints as thyroid function is slowing down. For women, thyroid function can have a big impact on what's happening with their function of their ovaries and what's happening with female hormone balance in the monthly cycle, and it can be significant enough where if the thyroid is far enough out of balance, that in turn can be one reason why a woman is having difficulty getting pregnant as well. Obviously, if thyroid function slows down, that means metabolism slows down. It makes it easier to gain weight, as well as more difficult to lose weight. One digestive related symptom for thyroid is someone who tends to be more on the constipated side as far as digestive issues. That could be a strong indicator that thyroid function is struggling or slowing down. As thyroid function slows down, the intestinal system or movement through the intestinal system slows down at the same time. Typically with low thyroid and with fatigue, a person can be more prone to depression, difficulty thinking clearly, remembering clearly. Diana's making a comment. She has at least 8 of these, so that's not unusual. When I talk with people and they look at these list of symptoms, they can almost check off everything on the list. And so obviously the more things that you identify for symptoms, the more likely that you have a thyroid problem, or if you already know you have a thyroid problem but you're on a medication, then chances are that maybe you're at the wrong dose, you're on the wrong kind of medication, or something else needs to be done because it's not normal to be having all those symptoms. Here I wanted to go over what's called your body type. And I'm looking now as I converted this this PowerPoint over to this kind of webinar system. There's an image here that didn't show up. I probably have some other images that maybe didn't convert over very well. So basically, to give you a verbal description, a thyroid body type is one in which the body fat is distributed evenly throughout the entire body, and a lot of times blood testing can show the thyroid is normal, even though a person has kind of this body type, but in fact they do have a thyroid problem. In fact, an interesting thing with comprehensive blood lab testing is you can have lab testing where everything appears to be normal, but cholesterol is the only thing that is traveling too high for someone. That also can be another indication that that thyroid is starting to suffer. So that's one symptom of a thyroid problem, is cholesterol levels will increase. Typically, that thyroid body type, again, looking at symptoms, frequently they're tired, low energy, having kind of saggy skin under the arms. Nails can be more brittle, getting vertical ridges that travel the same direction of your fingers, up and down ridges on your fingernails. Hair is thinning or falling out. Again, the outer edge of the eyebrows is thinning or gone. Body temperature is low. A lot of times just having chronically low body temperature, chronically cold hands and feet as well. Since this didn't show the other body types, I'm going to kind of skip past these just to keep going on our conversation. So now let's get into the different thyroid lab tests. And again, there are easily a dozen or more of more common ones that can be done, but there's only a smaller number. In this case, I'm suggesting that there are 6 of them that experience has shown to be the most clinically relevant and helpful in diagnosing a thyroid problem and what needs to be done to fix that problem. So these are the 6. The TSH we've already talked about. We've talked about the free T3 and the reverse T3. And then the other ones are free T4, thyroid peroxidase antibody, sometimes referred to as TPO antibody, as one of the measurements for an autoimmune thyroid problem. And then thyroglobulin antibody as another measure of an autoimmune thyroid problem. So again, TSH, free T4, free T3, reverse T3, thyroid peroxidase antibody, and thyroglobulin antibody. And I'm going to go into detail on each of these as well. So Starting with TSH, so we've already talked about how TSH is the way by which the brain is communicating to the thyroid. It's telling the thyroid if it needs to increase or decrease in its function. And so whenever I am looking at lab results, and this gets into the frustration a lot of people have too as they're working with different doctors, is they're told their TSH is within the lab's reference range, so it must be normal. Well, as many of you know, the reference ranges that are provided by labs can be a very wide reference range. And really what's considered optimal, meaning the best function for your body, is usually a more narrow or kind of a smaller range compared to what the range that the lab will give. And so this is how I wanted to present the information to you. Is I'm going to go over each of the lab tests. I'm going to talk about really what's considered optimal, and then we get into functional and clinical highs and lows. And then the reference ranges that you see here are the reference ranges that I use based on the lab testing that I do and the company that I use. It might be that the reference ranges that you have for prior lab testing don't match up with the ones that I have. And the reason is, even though you would think that all labs would use the same reference ranges, that's actually not the case. Every lab might have a slightly different variation in the reference ranges, and usually those labs will base their reference range based on the population people they've done testing on. So there certainly is, thoughts about kind of standard ranges, but you might notice that if you get thyroid testing done at two different locations or two different labs, they might actually have two different reference ranges. So what I'm showing you here for reference ranges are kind of the generally accepted by most doctors, especially doctors that, like myself, who do functional lab testing or are more functional medicine type providers as well. So the optimal here we're looking at is 1.0 to 2.5. And then as we go higher than that for TSH, that's indicating a kind of slower functioning or a lowered functioning of your thyroid. And as we go lower than the optimal, again, the brain will produce less TSH when it's sensing that there is too much thyroid hormone in the system. Most often the reason I find that TSH goes down too low is because a person is getting overdosed on a thyroid medication. And so, there's too much thyroid hormone medication in the system, so the brain is producing less TSH, so it's a pretty clear indicator of that. The next testing, the free T4. So we talked about how the thyroid produces mostly T4 and only a little bit of T3, and that T4 needs to get converted into T3 to kind of be the active form that communicates with the cells and determines your metabolism and your energy levels. So we still, although T3 is kind of the main player, we still want to know what's going on with T4. And because T4 does still have some activity in communicating with your cells, it's just it's a far greater activity of T3. And since T4 gets converted into T3, we want to know what's going on with T4 as well. And so here are the optimal ranges. I did all these ranges in kind of a color-coded format. I color-code them kind of like a stoplight. In that green is optimal, so green means go. Yellow is, you can think of yellow as a caution when it's in the functional high or low range. And a caution, depending on the lab test, the caution would be, it's definitely starting to move in the wrong direction. Sometimes we'll take action on it, sometimes we won't. Typically with thyroid, we're more likely to take action compared to some other lab testing. And then obviously if it's in the red range, then you can think of red as a red flag or kind of a danger zone when it comes to how your body's functioning or how it's going to make you feel. We talked about the free T3 as being the main form of the thyroid hormone that's communicating to your cells and determining thyroid function. So here are, again, the optimal being 2.8 to 3.8. In reality, when I'm looking at lab tests for free T3, I like to really see that at 3.0 or higher. So I see a lot of people where they're testing at, let's say, 2.8 or 2.9. And technically it's within what's considered the optimal, but still their TSH is starting to travel too high. So again, the brain is quite sensitive in picking up on the amount of thyroid hormone, so even getting towards the lower end of the optimal can start to result in that TSH going a little bit higher. Reverse T3. We talked about how reverse T3 essentially has a blocking effect on that free T3 from communicating with your cells. The two reasons that we know of why reverse T3 goes too high is because there's too much cortisol in the body, and cortisol levels will increase in response to stress. So cortisol is a hormone produced by the adrenals. The adrenals are your main stress handling gland. So when a person is under a higher degree of stress, the adrenals will produce more cortisol. And one of many consequences of having too much cortisol in the body is that it will cause this reverse T3 to elevate, which in turn has that blocking effect and prevents T3 from easily connecting with and communicating to your cells. The other reason that we know of why reverse T3 goes too high is because of a lack of selenium. So now we know that a selenium deficiency will interfere with that conversion of T4 into T3, but also a selenium deficiency can start to cause reverse T3 levels to go too high as well. So regardless if elevated levels of reverse T3 is from high cortisol or selenium deficiency, we still want to get more selenium into the body to help kind of clean out or kind of convert out and get rid of this excess reverse T3 as well. And again, you can have all other thyroid hormone testing be in the normal range. You can have even all other thyroid testing be in the optimal range, but if reverse T3 is too high, that person is going to still feel as though they are suffering with low thyroid symptoms. Thyroid peroxidase antibody is one of the measurements for an autoimmune thyroid. There's actually several of them, but the two I'm showing here, the TPO or thyroid peroxidase antibody, as well as the thyroglobulin, which is the next one, are the most common ones to be elevated, and usually the most common ones that you'll see done in testing. Thyroid peroxidase is an enzyme, so anytime a word ends in ASE, that indicates that that's an enzyme within the body. Thyroid peroxidase, the function of this is it helps in transporting iodine into the thyroid gland so that iodine can be used to create thyroid hormone. It also does some transporting of getting the iodine out of the thyroid then into the bloodstream, where it then can be picked up and carried elsewhere as well. So if the immune system is creating antibodies to go after and attack and destroy this enzyme, this means that this can impair the ability for iodine to get into the thyroid gland. Even if a person is consuming enough iodine, there may not be enough getting into the thyroid gland, and therefore there is a lesser production of thyroid hormone. Thyroglobulin antibody, sometimes it's called anti-thyroglobulin antibody, which is a little bit confusing. The most updated wording is thyroglobulin antibody. This is another measure of an autoimmune thyroid problem, and we'll go into more detail about the autoimmune thyroid in a little bit here. But thyroglobulin is a protein, so anytime you see the word globulin, that's referring to a protein. And thyroglobulin is the main protein that's responsible for transporting thyroid hormone throughout the body within the bloodstream. So once the thyroid hormone's been produced by the thyroid gland, that thyroid hormone goes out into the bloodstream, and it's picked up by this thyroglobulin protein, and it's that protein that helps to carry or transport that thyroid hormone throughout the entire body. So if there is an antibody, if the immune system is creating an antibody to destroy or go after this protein, a person may in fact be producing enough thyroid hormone, but it's poorly getting transported. It's not getting transported very well to different parts of the body, therefore having a person suffer with the symptoms of a low thyroid function. So let me jump back to some questions here. Leslie's asking a question: over what period of time do you assess the thyroid before determining a course of action? Well, if you're doing an initial testing and it's coming with abnormal thyroid levels or values, then we take action right away. Once you get going, whether you're doing thyroid medication or you're doing a some other kind of natural or nutritional type approach. Typically, with thyroid medications, I know most medical providers, when a person gets started out on thyroid medication, they like to retest usually within 6 to 8 weeks. With a more natural or nutritional approach, typically it's about 3 months down the road from starting a protocol or starting recommendations. Usually would be 3 months would be the soonest that I would want to remeasure. I do have some people I work with, though, where their thyroid is so out of balance, I can work with them, and I get them going on a little bit more aggressive of a program to achieve thyroid balance. And I'll even want to check them within a month of that therapy just to make sure that we're moving in the right direction. So which is better? Tara is asking a question, which is better, selenium supplement or 3 Brazil nuts per day? And so she's mentioning Brazil nuts because that has the highest source of selenium within it. So it's great. It's always great when you can get a nutrient through a food source. But the problem is when you are looking at correcting a significant deficiency, a lot of times you have to eat so much of that food or food item where it's either going to take a long time because you just can't eat that much in a day's time, or you're eating so much of a food item that you run into a calorie issue just to get enough of that into your system as well. So typically, if there is an obvious selenium deficiency, I will certainly recommend a person be eating foods that have selenium. But my strategy is to be taking a selenium supplement, and it has to be selenium in the right form to get more benefit out of it. But then, doing that at a higher therapeutic dose for at least a few months to more quickly correct or improve that deficiency. Denise is asking a question, how can we get our doctors to run these other tests? I think sometimes you as the patient need to be your own best advocate, and maybe you need to be a little bit more, maybe not forceful, but more direct, maybe a little bit more pressuring, just saying that that you really want to have these tests done, and the bottom line is if your medical provider is not cooperating or not willing to do it, then maybe you need to find a different provider to go to. Marcella is asking, will my primary care provider run these tests? It took 3 requests to get my reverse T3 done, finally done today, thanks to an enlarged thyroid. So this is the frustration that a lot of people that I talk to have, is that a lot of times they'll only test TSH, or they don't want to do these more detailed investigations. And it's frustrating for me as well, because I have people who've been on thyroid medication for a couple decades, but they've never had the thyroid antibodies tested, so they never knew the reason why their thyroid is struggling is because it's an autoimmune reaction. And so getting that little bit of extra information now gives us additional ideas or additional therapies that can be done to help improve how a person's thyroid is functioning. So, and I think I spent a lot of time thinking about what are the reasons why most providers don't do the little bit more detailed testing of thyroid, because it's really not that difficult just to check off a few more things on the lab orders. And I think a lot of times it just goes back to that particular doctor's training when they were first going to school, and if they were told that you should only need to test TSH, and that's all they do, and really what they're not doing is they're not thinking outside the box. And so obviously, as I am working with people, I spend a lot of time outside the box, thinking differently and looking at these lab results more critically in terms of what's best for the body's function and what's optimal for how the body's functioning. So Aaron is asking a question. So if you know that you have an autoimmune disorder, for instance, Hashimoto's, which is the autoimmune condition related that's connected with low thyroid function, how often should you have these tests done? What is a good time frame to stay within? And should you continue to have all 6 tests done? So if you know that you have an autoimmune, let's say Hashimoto's, how often should you have these tests done? It kind of depends on if you're incorporating strategies or therapies to try to reduce that autoimmune reaction. Then I would want to see that testing done every few months to see if dietary changes or nutritional strategies are getting the effect that we're looking for. Should you continue to have all six tests done? I would have all, in terms of a yearly checkup, I would definitely want to see all 6 of those tests done. If you're getting retested every few months, and let's say you have only one of the autoimmune indicators that is high, but the other one's normal, you may not need to go and keep redoing the one that's been normal for you. But obviously you're going to retest the ones that were outside the optimal range. You're going to keep retesting those. Judy's asking if you have nodules within the thyroid that were biopsied and were benign, is there a need to recheck them in the future? That's getting a little bit outside the realm of my specialty, looking at nodules and the concern about cancer, and so that would be a better question that's directed back at your medical provider or the person that did the biopsies. So Diana's asking, on medicine, my MD says it's okay. So it sounds like she's saying on medication, her MD says her thyroid is okay. But if I want these tests run and the primary care provider won't, then where does the person turn? So one of the things that I do as I work with my own patients or clients is I will always do the more detailed testing of the thyroid. And so I have ways of getting this done, whether it's a kind of a special letter or document that I can create that you can forward to your main medical provider, or if there's just not the cooperation there, I have arrangements with another lab in the Twin Cities that can do this testing at a pretty significant discount when a person's paying out of pocket as well, just to make sure that you get the proper testing done, because that's going to make a difference in terms of what you're doing with your diet or what you're doing with other nutritional or other kinds of therapies. Is having enough of the right information that kind of empowers you or gives you the ability to make better choices to get your own thyroid functioning better, and therefore getting your whole body functioning better. Leslie's asking, I've heard that artificial sugars are bad for the thyroid. Is this true? Well, I guess I haven't heard specifically the connection between artificial sweeteners and thyroid, but certainly artificial sweeteners, many people do not react well to artificial sweeteners. And so when you think about things like NutraSweet, which is also called aspartame, you think about really what happens to a person in their body when they consume this as an artificial sweetener. So aspartame, when a person consumes that, the body will first will convert that into what's called formic acid. So formic acid is the chemical that results in the sting when a person's bitten by a fire ant. And so some people are more sensitive to that than others, so some people will react more strongly to how that gets converted into formic acid within the body as well. So, and some people are so sensitive to these, diet sodas and artificial sweeteners that it has some pretty major symptoms, even neurological symptoms like MS. I've heard multiple stories of people that were diagnosed with MS, and once they cut out all their diet pop and artificial sweeteners, all those symptoms went away and they were fine. Diana's also asking a question. I've heard the panel is about $325. Would that be correct? Not the panel that I do. When you're looking at just a thyroid panel, it's much less expensive. When I'm doing a comprehensive blood lab testing panel, which is measuring about 70 to 80 items, which also includes the detailed testing of thyroid, when a person's paying out of pocket, it's $199. If we're doing only thyroid testing, if we're testing these 6 items, it's going to be quite a bit less expensive than that. I don't have that dollar amount memorized, but it's definitely less expensive than the $199. Have I heard of the cold laser therapy for hypothyroidism? I have not heard of that. But you think about what cold laser therapy does. It helps to reduce inflammation. It helps to stimulate circulation. And so if there's a lot of inflammation or for someone there's poor blood flow, getting more blood flow to an area can help tissues to function better. So I could see where that could possibly be a benefit. Denise is asking, do you accept insurance? I'm actually no longer an insurance provider or provider for any insurances. And really the main reason is that the work that I do is considered a nutritional service, and most insurances don't cover that anyways. And so it is where for some of the blood testing, for some people, if they have good insurance coverage and don't have a high deductible, they can take a list of what I want to see tested. They can take that to their medical provider, and then hopefully that medical provider is willing to sign off on that and do the testing. The medical clinic does the test, they bill your insurance, and you get the results back to me. One thing that is true, though, is if you have access to a healthcare savings account or flexible or medical savings account, that money can almost always be used towards the testing or the services, even the supplements that I recommend. A lot of people have had good success with having their flexible medical or healthcare savings accounts take care of even the supplements as well. So let's get into more detail about the autoimmune thyroid. So what exactly is an autoimmune condition? So in general, an autoimmune condition is one where the immune system has become confused, and the immune system has essentially created antibodies to start attacking what we would consider normal tissues or normal things within the body. So it's important to understand that most people are not born with an autoimmune condition, and so what happens is something changes within that person's body chemistry over the course of time, where again the immune system becomes confused, and in this case we'll talk about the thyroid. So the immune system has become confused and has started attacking either the thyroid gland tissue or some aspect of thyroid function. So we talked before about how the thyroid peroxidase, that's an enzyme. So in this case, the antibodies are attacking the enzyme and not the gland, or the thyroglobulin antibody. The immune system is attacking the main protein that carries that hormone throughout the body. So it's not always that it's attacking the thyroid gland. It could be attacking some other aspect that's involved with thyroid function. So there are many different kinds of autoimmune conditions. You think about when the immune system is attacking the brain or the nervous system. That could be, for example, multiple sclerosis. When it's attacking the joints, it could be rheumatoid arthritis. If it's attacking the muscle tissue, that could be muscular dystrophy. If it's attacking the skin, that can contribute to something like psoriasis. If it's attacking the digestive system, that could contribute to celiac disease. But in this case, for the thyroid, when the immune system is attacking the thyroid, it's either called Hashimoto's thyroiditis, which would be related to an autoimmune thyroid condition for a low thyroid function, or it's called a Graves' disease when it's an autoimmune condition that's causing an overactive or hyperthyroid problem. So with an autoimmune thyroid, what my experience has shown is there's actually three main things that will promote the development or will continue to aggravate or enhance that autoimmune thyroid problem, resulting in either Hashimoto's or Graves' disease as it relates to the thyroid. So the first one is invading organisms. And so what this means is that, well, let me step back for a moment and better explain how this autoimmune process develops. So usually before the immune system became confused and started attacking, in this case, the thyroid gland or some aspect of thyroid function, the immune system, and so understand that that would be an abnormal immune system reaction because we don't want the immune system to be attacking the thyroid. Before it started creating this abnormal autoimmune reaction, it was first reacting against something else first as a normal reaction. So it's normal for the immune system to react against invading organisms like viruses and bacteria and parasites, or even kind of fungal or kind of candida type problems. And so because the autoimmune reaction is often paired with another reaction, and I'll go over what these three things are in a moment here, in order to be successful in reducing the autoimmune reaction, we also need to identify what was the initial reaction. So if the initial reaction was some kind of an invading organism like a virus, bacteria, or other organism, then we need to help the immune system and help the body get rid of these invading organisms. And so one of the ways that we know that the body is kind of burdened or the immune system is stressed with these kinds of infections is just through a simple blood testing, doing what's called a CBC, or complete blood cell count, where we look at what's happening with the white blood cells and different kinds of white blood cells. And again, it comes down to doing that more critical interpretation, or what we call the functional analysis with functional medicine, to know if there is some kind of a more chronic type of infection going on. And if that's the case, then if we want to be successful in reducing that autoimmune reaction, we need to help out the immune system and get these invading organisms dealt with, and basically get them killed off or get them out of the body. So that's one of the more common things that can then lead into an autoimmune thyroid problem. And so what can happen is you can have these invading organisms. For example, you can have a virus that can find its way, and actually the virus can enter within the thyroid tissue. And if the immune system is trying to go after that virus within the thyroid tissue and try to go after and kill that off, it's not too far of a distance for it to get confused and start attacking the tissue that the virus is located in. And so that's how a virus, as an example, can be connected to an autoimmune thyroid problem. To use a different example, a different kind of autoimmune condition, looking, let's say, with the nervous system and the brain with MS or multiple sclerosis. If that virus is located within the brain tissue, or specifically within the nerves, or that outer covering of the nerves called the myelin, if the immune system is trying to get after that virus that's within the nervous system tissue, it can be a short distance or an easy crossover where it might get confused and actually start attacking the nervous system tissue itself. The second thing is toxic heavy metals, or really any other kinds of chemicals or toxic things within the body. It's very typical that the immune system, as part of the way of dealing with these toxic elements, will create an immune system reaction to these as a way to kind of deactivate the effects of these toxic elements. And so because the thyroid, compared to other glands or tissues within the body, the thyroid is especially sensitive to the different kinds of toxic heavy metals. And specifically, these toxic elements can, again, get stored right within the thyroid gland. So if that's happening, and the immune system is going after these toxic elements that are stored within the thyroid gland, again, it's a very short distance, or very easy for the immune system to get confused and then start attacking the thyroid gland itself or some aspect of thyroid function. So just like it's easy to identify if invading organisms are part of the problem, it's also pretty easy to measure if toxic heavy metals are part of a person's problem. Typically what I do, it's called a heavy metal screening test, which is a small little box kit that a person will purchase, and I will just mail it directly to their address with the instructions. It's a screening test you actually do on yourself in your own home. It's a pretty simple looking little kit when a person gets it, but everything, of course, you need is in there. And what a person is doing is, in the convenience of your own home, is you're gathering a small sample of your own urine, and this is just within a clean glass or plastic container. It doesn't have to be a sterile container because we're not looking for bacteria. And then just following the instructions, you follow the step-by-step instructions. It takes about 15-20 minutes, and you'll see the results right there. You actually don't have to send your sample anywhere. You see the results right there when you're done, and then a person will usually contact me or email me with the results, and we'll talk about what to do with that if it comes back positive for the presence of toxic heavy metals. This screening test will measure for 6 different elements. Typically, if one of these 6 will show up, there's actually other ones that a person probably has exposure to as well. And then the third item is food allergies or sensitivities. And so just like I was talking about earlier, the connection between thyroid and the person was asking about avoiding wheat or gluten. So this is most typical with an autoimmune thyroid problem. Some resources or doctors will state that easily 80% or more people that have an autoimmune thyroid, they automatically have a sensitivity to wheat and gluten. And I find in my own investigation and helping people that will very commonly show up to be the problem. But I don't want that to mislead you. You know, that'll be a common recommendation when a person has an autoimmune thyroid, is I will just recommend, you know, let's go ahead and go off, you know, anything that has gluten in it for a few months and see what that does to your antibody levels. But it's possible that it could be some other food item as well. So in reality, it's kind of fair game. It can potentially be pretty much any food item that a person is reacting to. It's a safe guess, a pretty safe assumption and a safe educated guess that wheat or gluten is part of that problem. But it could be just as likely that there's some other food item or food group that is equally or more so the problem that's encouraging that autoimmune reaction. So again, when the immune system becomes confused and starts attacking the thyroid or some aspect of thyroid function, usually the immune system was doing something else first. The immune system was going after invading organisms, it was reacting to toxic heavy metals or other toxic elements, or it was reacting against a food. And from that normal reaction, it crossed over and became an abnormal reaction where the immune system is now going after the thyroid or some aspect of thyroid function. So if you want to have any degree of hope of reducing that autoimmune reaction, you need to identify what was the original reaction that was taking place. Was it some invading organism, some toxic heavy metal or other toxicity issue, or was it some kind of a food allergy or sensitivity, which very commonly it's one or even a combination of those things. And I did, as a fourth item, I wanted to add in inflammation. Not so much that inflammation will cause an autoimmune problem to develop, although I guess that's possible. More so that once an autoimmune thyroid condition is going on within the body, and this can not just be of the thyroid, it could be any kind of autoimmune condition. Inflammation is interesting in that when inflammation is going on too much in an uncontrolled way, that inflammatory reaction can become part of what's promoting or enhancing that autoimmune reaction. So for some people, for them to get their autoimmune thyroid or other autoimmune antibody levels under control, they first need to get the inflammation under control. And so that's another thing that I will always test for in my more comprehensive blood lab testing, as I'm looking to see if inflammation is part of their problem. Then I want to mention there's a couple key nutrients that are helpful in reducing the autoimmune reaction. The first one is vitamin D3. Of any vitamin or mineral, easily vitamin D3 is one of the most beneficial and one of the most powerful in taking an immune system that's gone out of control and help bringing that under better control. Vitamin D is beneficial in many, many other ways as well. It's important for blood sugar control, for hormone balance, balance of brain chemistry. It's important for immune function in the sense that vitamin D has some pretty significant kind of it's more antiviral benefits. Probably the biggest benefit of vitamin D is the cancer protective effect, in that vitamin D helps to suppress or prevent the proliferation of abnormal cell growth, which is really what most cancers are cells that are growing abnormally, and so vitamin D helps to suppress that abnormal cell growth. But as it relates to an autoimmune condition, and again, this is not just autoimmune thyroid, this could be any kind of autoimmune condition of any vitamin or mineral, vitamin D3 is easily one of the most beneficial, helping to regulate or bring under better control an immune system that's gotten out of control. The other nutrient would be omega-3 fish oil. And in part probably because it does have some anti-inflammatory benefits, just like vitamin D has some anti-inflammatory benefits. But if I were to take a nutritional approach to what could a person be taking to reduce an autoimmune reaction, then I would be looking at recommending vitamin D3 at the right therapeutic dose, omega-3 fish oil at the right therapeutic dose, and inflammation is part of the problem, be taking things to reduce inflammation within the body. And that would be a good start, although we would still need to identify if there's any kind of a chronic infection, toxic heavy metals, or some kind of a food allergy or sensitivity. If you incorporate all those things within a strategy, then you're going to by far have a greater chance to bring under better control an immune system that has gotten out of control. Let me go back to the questions here. Diane is asking, how do you get those organisms out of the thyroid? What do I think of essential oils for therapy? So Basically, the challenge in getting rid of invading organisms is giving the immune system the resources, is just getting the immune system to recognize it in the first place. And it's not so much that we're getting the immune system to recognize the virus within the thyroid. We just want the immune system functioning better so it recognizes any virus anywhere in the body, regardless if it's in the thyroid or anywhere, so the immune system can get rid of that and take care of it. What do I think of essential oils for therapy? I think essential oils can be very powerful. I know a lot of patients that use them. I haven't personally studied them in great detail, but I am confident that there are therapeutic benefits, and I like them. Rachel's asking, what dose would you recommend for vitamin D? And basically, I prefer to let the lab testing of vitamin D levels determine the dose that a person is taking. If I don't have any lab testing on someone, I'm comfortable having them go to 4,000 or 5,000 units. So usually you'll see it listed on the bottle as IUs or international units. So going to 4,000 to 5,000 international units is usually quite safe for anyone without lab testing. I would not go to a higher dose than that unless I have lab testing that shows that there is enough of a deficiency where it warrants going to a higher dose. With lab testing, I will commonly go to up to 10,000 units a day, which I know sounds like a lot to a lot of people, but the reality is when a person is really deficient in vitamin D, even at 10,000 units per day, when I go back and redo lab testing a few months later, they're still not yet up to the optimal. So some people are just so deficient that it takes a higher dose and takes a little bit longer to get vitamin D levels built back up into the system. Rachel's also asking, what would be a reason for fluctuating between hypo and hyper if one is not taking thyroid medication? That's a good question. It could be I guess the most likely possibility is that there is an autoimmune reaction going on, and again, the autoimmune can result in either low or high functioning thyroid. Depends on how the autoimmune reaction is affecting that thyroid function. Is it affecting it in a way where it's suppressing it enough, or is it affecting the hormone levels where the brain is sensing that there's not enough, so the brain is telling the thyroid that it needs to produce hormone, so then it's producing more hormone to cause the hyperthyroid. So typically if a person is kind of bouncing between hypo and hyper, it would almost always be because of an autoimmune thyroid problem. And then what will end up happening is in time, it will no longer be hyper or overactive. It eventually will end up just being low thyroid. Aaron is asking, so is it possible that I could control my Hashimoto's without medication? Well, it certainly is. And in fact, taking medication really doesn't do anything to control Hashimoto's in the sense of the autoimmune problem. And this might go back to why some medical providers, I find, they won't even bother testing for the thyroid antibodies, testing for an autoimmune thyroid problem, because medically they really don't have anything in their toolbox of therapies to be able to help a person deal with the autoimmune thyroid problem. They'll just put them on thyroid medication, and that's pretty much it. Whereas when we approach it from a more natural approach, there are several things that we just talked about that we can do to help reduce that autoimmune reaction. But you want to understand that regardless if you're trying to reduce an autoimmune thyroid, regardless if you're doing that with a medical approach or a more natural approach, we don't yet have the knowledge or the resources to totally eliminate that autoimmune reaction. But where we have an advantage when we do more natural therapies is we have things that we can do to reduce that autoimmune reaction, whereas medically they don't really have anything with that. They just typically just put you on a medication and just maybe they might test it every now and then, and just assume that you're going to be on medication the rest of your life. So the question then is, are you frustrated? So I got a lot of, so going back to the questions here, I actually have a few more questions from people that had emailed me prior to this webinar, so I'm going to go through some of those. Here, Doris is asking, is it true that you could have high blood pressure from hypothyroidism and what can we do to make it better? I often have headaches and a pounding in my heart and head. So, Doris, what this really sounds more like to me is it sounds more like an adrenal problem. So this brings up a good point of talking about what's the difference between your thyroid and your adrenals. So basically, both are involved in the energy that you have during the day. So as you and I are just kind of sitting in place like we probably are doing right now, as I'm talking and as you're listening, just kind of sitting, not really moving around, that's your thyroid that's giving you the energy that you need. As soon as you get up and move around, that's your adrenals that are kicking in. And so the adrenals help to give a person that get up and go, give a person that motivation to get stuff done. And so a person who is low in energy as well as low in motivation, and maybe they can get a really good night's sleep, but they wake up in the morning and they're just tired right from the beginning of the morning, could be an indication of a thyroid problem, but it could also indicate that there might be something going on with the adrenals there as well. So typically as a person's thyroid is struggling or decreasing in function, the adrenals will try to work a little bit harder to pick up the slack, but the adrenals can only work harder for so long to where the adrenals start to get fatigued and they start to suffer in their function. And now you have low thyroid and low adrenals, and these are the people that are more chronically tired or may fall into kind of a fibromyalgia, chronic fatigue type of category as well. Denise is kind of the comment in the question here. She says, I know my thyroid is not working properly despite the test results. Health providers seem to be stuck on a number, not how the patient is actually feeling. I currently see a family medicine doctor. Should I be seeing a specialist? And she just comments she's very frustrated. So this is the same frustration that a lot of people I talk with share, is that they don't feel like they're being taken seriously. They don't feel like their provider is listening to their different symptoms. They just go based off the TSH looks normal, your thyroid is fine, it must be something else is going on, or it's all in your head. And so you definitely could go to see a specialist. In this case, the specialist for thyroid would be called an endocrinologist as far as a medical specialist. But I've had many people that I've seen that have been to endocrinologists, and for some reason they're still hesitant to do this more detailed testing. So, you want to go see someone that is kind of their standard procedure to do this more detailed testing, which of course I do, and I'd be very happy to help you or anyone who's interested in doing that kind of testing. Carrie here sent me a question. Says she's been taking thyroid medication for 15 years. T3 and T4 will test in the normal range. However, she still has symptoms of slow thyroid. She's interested in what other tests are available for more info on why she's tired, almost impossible to lose weight, heavy monthly cycle, sensitive skin. So basically, to go beyond the TSH, T4, and T3, and again with the T4 and T3, ideally you want to be testing the free form. You want to be testing the free T4 and free T3 as the most effective. And then looking at reverse T3 and then the couple thyroid antibodies, the thyroid peroxidase antibody and the thyroglobulin antibody. In reality, when I do my comprehensive blood lab testing, which covers a lot more than thyroid, but includes a very detailed testing of thyroid, it's looking at more than those 6 items. Because there's a few other tests that give me little indicators of things, but the 6 ones that I talk about are what I feel to be the most critical to for sure test those to have confidence that the thyroid's working the way it's supposed to. Roxanne emailed me a question. So she says she's currently taking a thyroid medication. Her doctor, who's testing her thyroid each year, says the thyroid or the TSH is in the good range. All these years, she thought, she was told that she might have fibromyalgia. She's wondering if it might be her thyroid instead. She hates feeling tired all the time, and also at any given time, something or multiple places in her body will just hurt. and there's a family history of thyroid. So definitely the symptoms that you're describing could easily be related to low thyroid function. So again, even though TSH is testing within a normal range, even if you're on thyroid medication and TSH is testing within a normal range, unless you're doing the more detailed testing, you may be missing an important piece of information. And if that thyroid is struggling just a little bit, even if it's not in a clinical hypothyroid range, but even if it's struggling a little bit, that can be a big hit on your metabolism, resulting in more fatigue, easier weight gain, more difficulty losing weight, more aches and pains throughout the body, hair falling out more easily, just a whole long list of symptoms that can go along with even a little bit lowered function. So I a lot of times will share with people that when I'm doing testing, they might not be clinically hypothyroid, but they're in what I call a pre-hypothyroid range. Just like a person can be pre-diabetic, they're not fully diabetic, but they're definitely moving that way. I will explain to people if the testing indicates that they're actually pre-hypothyroid. They're not clinically hypothyroid, but they're definitely moving in that direction. It's going to be far easier to do something about it now while they're in that pre-hypothyroid range versus waiting around for a few more years until they might be in that clinically hypothyroid, at which time they're even more tired, have gained even more weight, and feel even worse. Someone, they didn't give me their name here, emailed, says, just more of a comment, I guess. I think what is frustrating is that they, as a medical provider, just suggest medication. Also, I have Hashimoto's, and it affects my whole body. My antibodies are on overdrive. I had my left lobe of the thyroid taken out because the antibodies attacked it. Once it was out, I've had so many issues and other autoimmune-related illness. So it is true that once a person has one kind of autoimmune condition, it becomes easier to develop other autoimmune conditions. And again, hopefully with the information that I presented here, you'll better understand that there are actually quite a few other things that you can be investigated or that you could be doing that will help to help you manage or reduce that autoimmune reaction. Diane is asking a question here. So what would be the first thing you do for me if I came to see you? So the first thing I normally do is an initial consultation where I spend at least a half hour, sometimes a little bit longer, to get a detailed history about what's going on and what you've been doing to help kind of manage any symptoms or health problems. Typically, in my initial investigating will involve filling out a couple sets of questionnaires, doing the heavy metal screening test, and then doing this comprehensive blood lab testing panel, which includes the comprehensive testing of thyroid function as well. And so Denise is commenting here, so my vitamin D is at 20.1, which is definitely in kind of the low red range, the clinically low range. So if you have lab testing that shows you that you're that low in vitamin D, my normal recommendation would be to be taking 10,000 units per day of vitamin D3. And you could take it all at once. I like to kind of space it out where you do 5,000 in the morning, 5,000 in the evening. I think taking it, kind of separating the dose of things allows for a little bit better absorption, and your body can utilize that a little bit better. But yes, to answer your question, if a person is testing at 20.1 in their vitamin D levels, that is a case in which I would recommend they're taking 10,000 units per day. Tara's asking, what is the best way to treat fatigued adrenals? There's several different strategies, but it will almost always incorporate taking some kind of a adrenal support nutritional product, which will provide key nutrients that the adrenal needs in order to function better. But there's other things too. With adrenal fatigue, you're looking at, there can be some dietary considerations, keeping blood sugars under better control. There can be just factors that relate to how well a person is sleeping, getting enough rest, better managing stress, because the adrenals are the stress handling gland. So the adrenals are interesting in that definitely the adrenals take longer to bring back into balance or bring back into healthy function compared to other organ systems. Even things like thyroid and liver and other areas can turn around much quicker. The adrenals can be a slower process to improve how the adrenals are functioning. And the reason, again, is because the adrenals are your main stress handling gland. So even though we might be targeting the adrenals with therapies or with nutritional products to improve the function of the adrenals, we all still have stress in our life that's kind of competing with that at the same time. So I think that's why it takes longer to improve adrenal function. So if you're frustrated, meaning if you're on thyroid medication but you still don't feel good, you feel like you're still suffering with thyroid symptoms, if you have symptoms of a thyroid problem, even though your doctor says your testing is normal, if you're more tired than you used to be, you have a hard time losing weight or keeping weight off, you feel cold when everyone else is comfortable, muscles and joints hurt more prone to depression or altered moods, again, these are some of the more common symptoms. If that's the case, then typically when I do a seminar or in this case a webinar, some kind of presentation, people are interested in working with a doctor that specializes in an area like this or has a lot of experience like I do in helping people with thyroid problems or other different kinds of body chemistry or health problems. So I wanted to offer something special with the webinar, and so if you schedule for an initial consultation with me, what I'll do is normally that initial consultation, which is a lot of times I'll spend more than 30 minutes for the initial consultation. Normally it's $99. I'll go ahead and do that at half off for only $49. But an extra incentive here is if you sign up for the initial consultation with me before midnight tonight, and so this would be only for people that are watching the live webinar, if you kind of sign up for this before midnight tonight, what I'll do is I'll also give you a free heavy metal screening test. So normally that's about $30. You'll get that for free. And that'll be sent to you after you do the initial consultation. You still have to pay for shipping on it. And so I know that heavy metal screening test really interests a lot of people, and so I wanted to give an extra incentive to go ahead and maybe talk with me. And the way I think of that initial consultation is I'm very low pressure. It's really just a time to focus talking all about you and what your symptoms and health concerns are. It can even be kind of a brainstorming session where you're just talking about what's going on, what you're doing, and I can maybe help you think of some things that you or no one else has thought of. Sometimes that initial consultation is not even about the person I'm talking with. It's a parent that wants to talk about their kid or another family member. It's really whatever you want it to be. But I'll do that at half off, and then you'll get if you sign up for that by midnight tonight, you can get that heavy metal screening test at no charge as well. So the way this works then is if you want to get that heavy metal screening test for free as well, what you need to do is you need to go to healingchoices.com, which is my website. You'll see a tab there for the online store. And then once you go into that, you'll see right away on that first page of the online store, you'll see an indication for the webinar special to purchase that. So go ahead and click on that to buy it, and then click on the word checkout in the upper right side of the page. Go ahead and finish that purchase, and then if you do that before midnight tonight, then that will let me know that that you want to meet with me. The people that go in and do this online, these are the people that I'm going to go ahead and get scheduled with me first as well, so you get kind of priority when it comes to scheduling. So my schedule is more limited this week, but either this week or right away next week, I'll be able to get you in to do that initial consultation with you. The other option is if you're not comfortable doing this online, is you can call me directly at 763-241-5436, and if you call me by midnight, I may not be able to pick up, but if you leave a message before midnight, then I'll still give you that same offer. Gail is asking, where am I located? So I've been for a while working at this clinic in Minnetonka, but my time there is kind of ending, and I'm going to have an office once again here in Elk River, which is where I've been located most of my time. And I'll be there at least one day a week, but a lot of my consultations now I actually do, especially the initial consultation, I just do it over the phone because a lot of people like the convenience of not having to drive somewhere. We can easily do the same conversation over the phone, but if your interest is to meet with me face-to-face, and if you live close enough into the area of Elk River in Minnesota, then within the next week or two, I'll have this small office set up where we can meet face-to-face if that's your preference as well. Roxanne is asking, or I missed your answer on accepting insurance, do you? I'm actually no longer a provider for any insurance companies. And the reason is the kind of work that I do with lab testing and nutritional therapies and the service I provide, it's all considered a nutritional service, of which insurance companies don't pay for that anyways. Insurance companies may cover the cost of lab testing depending on your insurance, which is why if you wanna see if your insurance will cover the cost of some of the lab testing, I can just provide a list of what I want to see tested. You take that list of lab testing to your medical provider. Hopefully they're willing to sign off on that. That medical clinic can do the testing, they can bill your insurance, and you just make sure the results get back to me. Also, like I mentioned, if you have access to a healthcare savings account or flexible or medical savings account, that money can easily be used to pay for any testing or services. Even had good success with patients using their healthcare or flexible or medical money to pay for the supplements that I recommend as well. And the reason why that works with the supplements is because these are being recommended based on a clinical investigation and by a clinician. And so, it's not just something you're doing on your own. This is basically being recommended or sort of prescribed for you by a health provider. Maria has a question here. I had a thyroid ultrasound. The radiologist says it's a cyst, and the doctor called it a nodule. Is there a difference? It depends on the person that you're talking to. A cyst typically is a fluid-filled sac. The body will typically form a cyst around something that's irritating tissue. So if you have some, and this could be not just within the thyroid, it could be anywhere in the body where a small group of tissue is getting irritated, so the body will form a cyst to kind of wall it off and separate that from the rest of the body. And usually that cyst becomes more of a fluid-filled thing. A nodule, more likely is going to be some kind of a solid type of thing going on within that tissue. And so, I guess that could be another question that I could defer to a radiologist or a medical provider. Is it really a cyst or a nodule, or what? How are they categorizing those two things? Okay. So I think we've covered all the questions. No more popping up on my screen here. So I just wanted to thank you for taking the time. I know I went a little bit over my time, but hopefully that extra time was helpful to you. And I'll leave up for a couple minutes here this contact information. If you want to give me a call if you have any questions or concerns, you want to shoot me an email, you're welcome to do so. Again, if you want that special offer of not just the half off the initial consultation, but if you want to get the free heavy metal screening test, you need to either purchase that on my website at healingchoices.com before midnight tonight, or at least call me and leave me a message knowing that that's what you want to do, and then I'll still extend that even based off a phone call or a phone message as well. All right. Thank you for attending. And again, this presentation is being recorded, and so I will send an email to everyone that attended or signed up for the live webinar. I will send you a link for the recording if you want to go back and listen to it again, or if you have a friend or a family member or someone that you know that you think would be interested in hearing this information, then you're more than welcome to forward the link in the email that I send you. Go ahead and forward that email to anyone that you want to so they can get the same education. All right, well, thank you again, and let me know if you have any questions or concerns. Have a great rest of your night. Thanks, bye.